Hello everyone, welcome back to the channel. If you don't know who I am, hi, I'm Nurse Akist. I'm a registered general nurse, and on this channel I usually talk about nursing stuff, behind the scenes of nursing, which is the nursing vlogs, and then nursing sit down videos where I do educate students, nurses, and then anybody who is aspiring to become a nurse. So I do study guides. I also give study tips, things you need to know about nursing, more things about general nursing, midwifery, public health, mental health, every nursing stuff. Yeah, so this channel is basically educational stuff related to nursing, okay? So if you are new here or interested to become a nurse one day, then this channel is for you. Don't forget to like, comment, and then subscribe to my YouTube channel. And please do what to take me to 1,000 subscribers, please. Today is November 1st, and I created this channel exactly November 28th. So I just have a few months to reach 1,000 subscribers. I'm pleading with you. If you're not coming across my video for the first time, please do what to kindly give it a thumbs up, kindly comment, kindly share, and kindly subscribe. Okay. So in this video, I'll be talking about the basic things every beginner nurse must know in our daily lives, whether you are a student nurse, rotation nurse, whatever nurse, as long as you are wearing the green and white or white, anybody can approach you and ask you anything related to nursing. So I just want you to know some basic things, whether you are in the community, wherever, so that you wouldn't fumble when people ask you these types of questions, okay? So let's start with vital signs. Vital signs is the basic or the baseline information for nurses. A patient comes to the hospital. The first thing we do for a patient is check vitals. We check it so that we can see whether the patient is faring well with medications, or we also see the problem which is happening to the patient. Vital signs entails the temperature, pulse, respiration, blood pressure, and then SpO2. Usually in school, we don't usually mention SpO2. But then at the hospitals, they use SpO2s most of the times. Okay, so with the temperature simply means the hotness and coldness of a person, right? So we usually use a thermometer. Now the normal range for temperature is 36.2 to 37.5. Some books say 37.2, whilst others say 36.5 to 37.5. Others say 36.2 to 37.2. But any of them are correct. I hope you get it. As long as you are within the 36 to 37 range, you are okay. Now let's go to pulse. Now with the pulse, it talks about how your heart beats. Yes. So the normal range for pulse for adults is the 60 to 100. 60 to 100 beats per minute. That is for pulse. But for kids, for the pedics, the children, when you are getting 120 or even 140, even 150, it's normal for kids or the pedics, the babies, and we're normal. So the kids, we usually start from 100 to 140, 150 going. It's normal for kids. But for the adults, when you're getting 150 something, that one is bad. Very, very bad. Adults is 60 to 100 beats per minute. I hope you get it. And with the pulse, we use the pulse oximeter to check pulse. So don't confuse yourself. Pulse is pulse oximeter. Yeah. And then we also have the respiration. Now, respiration is how the person is breathing. We are monitoring how the person is breathing, whether the person is breathing fast or slow. So with that one, you just stand at one side and then you check the way the person is breathing up and down. It is the rise and fall of the chest. But at times people use the stomach and but it's wrong. Okay. We use the breast watch to monitor the respiration. And that one you'll be taught in school. So with the breast watch, you time yourself 1 minute. Like you look at the breast watch and then you just look at how the time is moving. So when it's a time that pointer or whatever on the time or the clock is on maybe 8 o'clock, Then you wait till it goes round and become 9 or back to the 8. Yeah, that is how we monitor the respiration. So you give yourself 1 minute to monitor the respiration. The normal range is 12 to 20. You count. Yeah, you count the rise and fall of the chest. So when it goes up and comes down, it's 1. When it goes up and comes down, it's 2. When it goes up and comes down, it's 3. So that's how we monitor for the respiration. Okay. And then we also have the blood pressure. The blood pressure, the instrument we use for checking the blood pressure is the sphygmomanometer. Now with the sphygmomanometer, it checks the person's blood pressure, like whether the person is hypertensive or hypotensive. And the hypertension is higher than the normal range. The normal range for BP, we have 2 ways of checking the BP. We have the systolic, which is on top. Reading there on top near systolic, and then the reading on the down is diastolic. So the systolic is within 90 to 130 grad. It's okay. Yeah, normal range. 90 to 130 is okay for the top part. And then the down part is 60 to 90 for the down part. But when you're combining all together, we say the normal range for a normal human being is supposed to be 120/80 for the normal blood pressure. So normal blood pressure is 120/80. Okay, check your BP. Now, chrome a jump baby, and you wrap the cuff around the person's arm. It's the normal range is 120/80. But if the person has 130/80, it's okay. If the person is going above 130, that means the person is getting closer to hypertension. But if the person has a low one, which is below 90/60, then the person is going to hypotension. So we check the normal range for the top part is 90 to 130, and then the lower part is 60 to 90. So you have to be checking the range. You have to be checking the top part and the down part. Somebody can be getting 130/120 for the down part, top and down. Top one over 130, down part over 120. You get it. So you don't check only for the top part, while we check the top and down. That's it for the blood pressure. And then for the SpO2, SpO2 is oxygen saturation. How your oxygen in you is, like how it's saturated in you. That's how I can put it. Because somebody can be sitting here, all right, but the moment the person is gasping for air, like ohia frama, ubon say ne oxygen level no eswate every 95 abesia ko 70 80. But that person, the person needs oxygen mask. Yeah. So the normal range for the oxygen saturation is 94 to 100. Some people say 95 to 100. But the moment you put the pulse oximeter on the person's hand, kindly check for 95 to 100. Who send you 95 to 100, the person doesn't need any oxygen mask. But if the person has below 94 going down, or 80, 70, the person needs oxygen mask. So that is how we check the vital signs for basic or for beginners. So do well to memorize it accordingly. Now, away from the vital signs, now let's go to the types of beds, because in nursing we do practicals too as well. And as a nurse, you have to know how to lay the bed. So we have the types of bed. We have the simple occupied bed, simple unoccupied bed, operation bed, cardiac bed. We have the fracture bed, divided bed, but the divided bed, we don't do it. I don't even remember, even through my practical times as a student, we didn't do anything like divided bed. We didn't do something like that. But with the usual ones, which is at the hospital, no, occupied and unoccupied. Now with a simple unoccupied bed, it simply means that there's nobody in the bed. Unoccupied. Obi any bed in him. Like obi under bed in the so into a fresh. The bed sheets, everything is fresh, everything is tucked in together. But the moment maybe where the person gets down, like we fold some parts of the blanket on top. It simply means the person is in the bed. So that one is occupied. Occupied means obi abeje bed not so like obi abedim. So don't confuse yourself when you're in school. Occupied means that the person is in bed. Yeah, the patient have to bed in this one. But the patient can be on the bed or can be outside, can be in the urinal, can be bathing. But the unoccupied one, there's nobody in the bed. There's nobody sleeping on the bed. No admission is there. You lay bed in the fresh. But obia and lasso. We also have the cardiac bed. Cardiac bed is for heart. Cardiac means heart. So the bed is purposely for people who have heart problems. And with that bed, it usually has 6 pillows on it. 6 pillows. And I say even a heart table on it, a bell, and sandbags at the foot side. A friend is saying, cardiac bed. Cardiac bed is for people who have heart problems. And then we also have the operation bed. With the operation bed, we do not have a pillow on it. So do not confuse yourself. We do not have any pillow on it. With that one, it's just a towel. Some small towel will be in there to the tida bremon, maybe I didn't need where the person will place their head. That is the operation bed. We do not have any pillow on it. We place the pillow at the side. Yeah, that's baby. But when the patient is recovering, that's when we put the pillow back. But when the patient is back from the CS or the room, we do not put any pillow there because the patient can aspirate. Because of the operation, everything within the patient is now like on a standstill. Bibia a movie. The moment you cut the person open, everything is on like some ways. The patient will start like drooping. Yeah, into room. So we usually clean their mouths with a padded spatula and a lot more. So with that patient, we usually do not give them pillows. Otherwise, so we just tilt the head like this. Tilt the head to the left side, and then the saliva comes out. So we do not use any pillow for such a patient for the operation bed. And then we also have admission bed. Admission bed is just like the operation bed. We lay it like the operation bed. It's like the patient has come new. More admitted patients, but with that one, we have a pillow on it. But with the operation bed, we do not have any pillow on it. But with the admission bed, there's pillow on it. Now with the hospital settings, we do not follow the school way. School way, you will see bottom sheets, you see a top sheet, you see a Macintosh on it, you see pillows on it. But with the hospital settings, you can just see just one bed sheet on the bed, and that's all. So please be taking the school ones very seriously. I don't have all the items at home, so I can't really demonstrate the best for you. But I would say that just follow the NMC procedures. They'll give it to you whilst it's practical time. So please do well to follow it as well. So apart from the beds, now we have positions. How the patient must lie. We have bed positions for every patient. Now we have the fowler's position. We have semi-fowler's position. We have lateral position. We have dorsal position. Prone position. We have Trebelenbeck position. We have the lithotomy position. So we have different types of positions here and there. And I would make a separate video talking about the positions into details, but I can say that the most common one or the most reliable one nurses usually use is the Fowler's position. Use the Fowler's position more. Fowler's position is the position whereby the patient is like on bed, but then the bed is lifted a little, 45 degrees. That cause stroke crack. So the patient's in the very comfortable. Yeah, that is usually the most common position nurses use. With the dorsal position, the patient is on the back, dorsal, on your back. So when the patient, your head is hitting, your occiput is on the pillow, it means dorsal position. The moment your forehead is facing the pillow, is prone position. So I think you have to know the difference. Dorsal is on your back, your occiput on your pillow, and then the prone is your forehead is on the pillow. Aha. And then lateral is on your side. It's the side one is usually comfortable for the pregnant women because for theirs they are pregnant, so they usually lie on their side, on their left side, so that the baby can be comfortable as well. And the lithotomy position is usually the position for delivery. When you're giving birth, the way you lie to open your legs on top, when be your name, so that we can deliver, like we can bring the baby out. That position is the lithotomy position. So I hope right now we know something more about the positions. So now let's talk about common abbreviations in drugs. I know currently right now that we are in level 100, we don't really know anything about the pharmacology. Yeah, but then being a nurse, whether you are a student nurse, whatever, people don't see you as that. People don't see that you are a level 100 student or 200 or whatever. They see it as you are a nurse. And it's normal. I usually get it all the time, even in the communities. People come to me that, oh, Auntie Nurse, even at home, my younger brother, when he goes to a pharmacy, he doesn't even listen to the prescriptions. He comes to me. So you being a nurse, your relative also see you as like you know more things about the health. So today let's learn about the common abbreviations too as well. So with the common abbreviations, we have OD, we have BD, we have TDS, we have QID, we have Notch, we have STAT, we have PRN. There are a lot more in nursing. Okay, so now let's talk about the OD. OD means once daily. It means that when you take the drug in the morning, you're taking it the next day. When you take it in the afternoon, you're taking it the next day. When you take it in the evening, you're taking it the next day. That is how the OD simply means. You can see it as once daily. You can see it as daily, only daily written there. That one is straightforward. Or you see OD written there. We also have BD. BD means twice daily. It means that you're taking your drugs 2 times in a day. You take it in the morning, 6 o'clock, 12 hours time. You take the next dose in the evening, or the 12 hours time. Yeah. So you count 12 hours after you've taken the drug. That is how it is. So you take maybe the drug 6 o'clock in the morning, you count 7, 8, 9, 10, 11, 12, 1, 2, 3, 4, 5, 6. You see, 12 hours nasu. So that means I'm taking the drug in the evening, 6 o'clock. Let's go to TDS. TDS is 3 times daily. It means that you're taking the drug 8 hours interval. So 8 times 3 equals to 24. So 24 hours in a day, you get it. So we have divided the drug into 3 times. You take the drug 6 o'clock and then you calculate 8 hours after it. 7, 8, 9, 10, 11, 12, 1, 2. You get it. So now it is 8 hours per. You take the next dose 8. You take the next dose 2 o'clock in the afternoon. You count the next 8 hours. You take the last dose. So you take the drugs 3 times in a day. That is how we take TDS drugs. Now you go to QID. You see a drug written QID. It simply means that you are taking it 4 times in a day. You count 6 hours interval. 6 o'clock and upon you count 7, 8, 9, 10, 11, 12. 6 hours nasu. Then you take the next drug. You count the next 6 hours till the 4th dose reaches. Then you are done for the day. So that is how we take those types of medications. Now, usually for the malaria drugs like this, it is 2 times daily. You are taking the drug maybe 6 o'clock in the morning. You count the next 12 hours. That is how malaria drugs are. So you take it in the morning, you count it 12 hours. Time be obeka, you know. Some people always ask me that, Mavis, I've forgotten the time I should take this drug. They told me that I should take it 7 o'clock. I've now remembered to take this drug. So what time should I take it? Should I wait for the 6 o'clock again, or what should I do? Take it immediately. That is it. Take it immediately. The moment you remember the time, just take it. So you're supposed to take the drug maybe 8 o'clock in the morning. You remember that, oh, let me take it 10 o'clock. 10 o'clock, take the drug 10 o'clock, and then count 12 hours from there. That is how it is. So 12 hours intervals, 8 hours intervals. Anytime you remember the drug, the time, just take it from there, and then you count the hours which is supposed to reach the next hour. That is how you take the drugs. We have start. Start simply means immediately. You give it immediately. You give it right away. You don't waste time. Now, with the hospital settings, we have some people who have these conditions whereby you have to give the drug immediately. And now, if you're now 8 hours time and not 12 hours time and not 6 hours time, we give it immediately. So the start medications are immediately. When you see it on the drug charts at the hospital, it simply means immediately. Okay. We also have PRN. PRN means as per needed. As per needed. As per needed means that if you have a headache, we don't wait. Headache comes impromptu, right? Some types of like conditions comes impromptu. I was so paid the mano. That is how it works. So with the malaria drug, you have to test before you take those drugs. But with the headache or those types of drug, we don't have anything. We take it whilst we need it. So with a paracetamol like this, your head aches, you get a paracetamol, you take it as per needed. That is the meaning of that. And then we also have the forms of the way the drugs comes in. We have oral. Oral can be the tablets and then capsules. You are putting it inside your mouth. You take it with water. A patient can bring you a medication that suppository. What does suppository mean? Suppository means that through your anus, you put it inside your anus. That is the type of drug. We usually give it to children. Yeah, some children don't like drugs in their mouth. You just put it inside their anus, and that's all. We have some medications whereby the same type of medication, we can give it to adults. The pregnant women like this, we give them medications where they put it inside their anus. So we have suppository drugs. We have the syrup drugs. Syrup one, you have to shake. You shake it, and then you drink it. We have the IV. IV is through your veins. So, and once in so, focus in so. Yeah, so that one is through the veins and then it goes inside your body. So those are the forms of drugs. So I think those are the basic things when it comes to nursing as a beginner. And I just hope that this video has helped you. Don't forget to like, comment, and then subscribe to my YouTube channel with a thumbs up, please, so that YouTube will see it as if this video is more educational. Thank you and bye. Mwah.